Good morning, everyone, and welcome to the Municipal Retiree Benefit Trust information session. And today's session will discuss MPP retirement health benefits and key facts about those benefits. My name is Heather, and I'm a Strategic Communications Advisor with BC Pension Corporation, and I'll be your moderator today. Here to answer your questions are Bonnie Pearson from the Municipal Retiree Benefit Board of Trustees, and Monique Klein from Pacific Blue Cross. So today's session will be recorded and posted to the MPP Plan website. However, please rest assured that only the panelists and moderator will be recorded. Microphones and cameras are turned off for all attendees. We will take your questions shortly, but first we'll hear a short presentation from Bonnie. So I'll hand it over to you now, Bonnie, and we can advance to the next slide. Thank you.
Thanks, Heather, and thank you everyone for joining us today, taking a little bit of time out of your busy day to learn more about the Municipal Retiree Benefit Trust, or the MPRA. The MRBT, I'm sorry. We provide an extended health care plan that is supplemental to what is covered by the Medical Services Plan. It includes coverage for prescription drugs and other expenses, such as medical aids and supplies, as well as the cost of other medical and health services. This extended health care plan is subsidized for members based on their years of pensionable service in the Municipal Pension Plan, or the MPP. The MRBT also provides members with access to 2 dental care plans. Members pay the full premium for these plans, however, the premiums reflect the MRBT's group rate and may provide better coverage than an individual plan could offer. The MRBT contracts to Pacific Blue Cross, or PBC, to process our retiree extended health and dental coverage. And the funding for the extended health and dental coverage comes from 0.6% of MPP employer contributions, member premiums, and investment returns. This is why the Board of Trustees is focused on the sustainability of the trust and the benefit plans. This sustainability requires managing the costs of benefits paid while also ensuring members receive valuable supplemental health benefits. Next slide. Our 2023 annual report highlights that the MRBT has funding to support 31.3 years of benefits at current benefit and subsidy levels. However, the cost of benefits and the needs of members are increasing, as we've said in the past. So this means that we must carefully review coverage and make the tough decisions about what is covered today to ensure that future retirees also have access to coverage through the MRBT. We want to ensure that you understand our work and encourage you to learn as much as you can about benefits coverage and the funding. More details on the MRBT's funding are available on the MRBT website. We'd now like to share with you 3 key facts based on questions, concerns, and feedback we've heard from you over the past year. Next slide. Coverage by the MRBT will not be the same as coverage you may have had while you were working. When you retire, any health coverage you have through your employer stops. MPP members can choose to enroll in coverage offered through the MRBT, which is a different plan with different coverages and limitations. We're pleased to share that the MRBT plan now covers clinical counselors under the psychology benefit in support of the retiree mental health and wellness. And we were able to make that change in 2023. We work with Pacific Blue Cross, which processes benefit claims and reimburses MRBT plan members. And we encourage you to carefully review the MRBT benefits plan, especially if you are newly retired. And you can find more information on that at pac.bluecross.ca/MRBT, and we'll share that link in the chat. Next slide, please. At present, the information we've received from the Government of Canada regarding the Canadian Dental Care Plan indicates that pensioners who have access to a dental plan, such as the one offered by the MRBT, are not eligible to enroll in the Canadian Dental Care Plan. And this applies regardless of annual household income. If you cancel your coverage through the MRBT, you will not be eligible to re-enroll in the future. There is one exception, however. You may be eligible if you opted out of the dental plan offered by the MRBT before December 11, 2022. Members in this situation should contact Service Canada directly. The MRBT board encourages members to review all the information about the MRBT and the Canadian Dental Care Plan carefully before making any decisions on your dental coverage. Next slide. When you start collecting your pension, you have the option to sign up for extended health and dental coverage through MRBT. If you waive coverage at retirement, you have 60 days to change your mind. Once those 60 days have passed, you can only enroll if you've had continuous coverage under another health plan. And you must enroll within 60 days of that other plan ending. So we recommend that you carefully review eligibility requirements before you make any decisions about coverage. You'll find that information as well on our website. If you have questions about eligibility, enrollment, or premiums, you can visit myaccount.pensionsbc.ca to ask them via the message center. That link will also be added to the chat. Next slide, please. If you want to learn more, we put 2 links up on the screen, and we'll also post these links in the chat. Visit the first link to read our 2023 annual report and learn more about the Trust's funding and governance. And visit the second link to read the Extended Healthcare and Dental Plan booklet and other helpful resources from Pacific Blue Cross. I also want to say that we're happy to, with the cooperation of MPP, on the MPP landing page, there is now a promotional box for the MRBT, which will take you directly to additional plan information. So I'd encourage you to look at that. And now I'll pass you back to Heather so that we can begin the question and answer session.
Great, thank you so much, Bonnie. So to submit your question, you want to send it in via the Q&A feature, and I will pass it along to Bonnie and Monique. And today's session is best suited for your general questions about your health and dental benefits. If you have questions that are related to your specific circumstances, there are a few options. For questions about what's covered or how to make a claim, you can contact Pacific Blue Cross at pac.bluecross.ca/member or by calling 1-877-722-2583. And again, I will share that in the chat. For questions about eligibility, enrollment, or premiums, you can submit those through Message Center at myaccount.pensionsbc.ca. And if you need to find more information about retirement health coverage, you can also read the Extended Healthcare and Dental Plan booklet at the MRBT microsite at pac.bluecross.ca/MRBT. And we're thrilled to have so many attendees with us today. Because of the sheer volume of questions we're expecting, we may not be able to address everyone's question today, but we will point you to some resources that are available to answer many of your other questions. So we're going to start out today with a question for Monique. So Bonnie mentioned that the health and dental coverage booklet and brochure are available. Are those also available in a hard copy format?
Yes, so you can print a copy of the booklet from the microsite, which Heather's mentioned previously. You can also request a hard copy booklet from BC Pension Corporation. They can send you a hard copy directly, but all of the information is available on the microsite for viewing.
Great, thank you, Monique. We're just having some technical difficulties with the chat, but hopefully we will be able to get those links out into the chat for you momentarily. Question number 2 is there's been a lot of questions about expanding areas of coverage. Bonnie, can you comment if there's a review of coverage coming up?
So the board does plan to do a review. Our policy says we'll do a review at regular intervals. We do review all of the requests that come in from members once annually. But we're now in the process as a board of considering the scope and the mandate of a full review. There'll be more information forthcoming on that in 2025. I can't tell you any more details because those decisions haven't been made, but there will be a review upcoming, and once that decision is made, the board will communicate that so that there'll be an opportunity for members to know that.
Great, thank you, Bonnie. So our next question is for Monique, and that is, does the extended health and dental plan cover travel to the US?
No, unfortunately not. Emergency out-of-country coverage is not covered under the MRBT plan. The MRBT plan covers a whole host of other benefits in Canada, but it does not cover emergency out-of-country coverage. You need to go purchase travel coverage if you're interested in health insurance while traveling.
Great, thank you, Monique. We're going to go with a question for Bonnie now. So if you join if you retire mid-year and join the plan, does the deductible from your pre-retirement plan carry over?
No, as I said in my previous remarks, when you retire, you are joining a new plan. So your deductible does not carry over. You'll start over. Our plan includes a deductible of $100 per person each calendar year. And as you know, the deductible is the amount that must be paid by you or your dependent in each calendar year for your coverage to be reimbursed.
Great, thank you so much. Sorry, just one moment while I scroll through these questions here. Monique, can you tell us a little bit more about what's going to be covered under the dental plan, and does it include coverage for implants?
Yeah, so implants are not covered under the dental plan, but a whole host of other benefits are. The dental plan has coverage for both the essential plan and enhanced. And the enhanced plan covers major and basic services, and the essential plan covers the basic services. The enhanced plan, which has the major services, incorporates things like bridges, crowns, dentures, and such, but unfortunately, implants are not included.
Great, thank you. Another question, this is a question for Bonnie. Has the MRBT considered switching to a different health and dental carrier?
We have not at this time. When you do a complete plan review, as we will, as I said previously, we'll have that upcoming. The scope of that will be determined. One of the things that we will look at is the current provider. I would say to you that from the perspective of the board and the plan members we hear from, in the majority, people are not dissatisfied with the service that they're getting. People are looking for improvements, but that will be reviewed when we do our plan review.
Great, thank you. Now we have a question for Monique, and that is, if a member is waiting on the status of a claim that they've submitted, is there a way for them to check on that?
Yes, so most claims are actually paid practically instantaneously through the electronic submission capabilities we have right now. But you can check the status of your claim if you go log into your member profile on our website. If it has been paid, it will be, or recorded, it will show up there. In addition, you can also call into our call center for more information. Once the claim is entered into the system, members can find all the information online, but you can always call into our call center to find out more information and get updates.
Great, thank you. Another question for Monique then. If a member has canceled their dental coverage, are they able to re-enroll?
No, unfortunately, once the dental plan has been canceled, there's no opportunity for re-enrollment. You can potentially look into individual coverage, but that will not be the MRBT group plan coverage.
Great, thank you. So continuing on the theme of dental, if a member currently has essential dental, can they upgrade to enhanced, and is there a waiting period for that?
Yeah, so if a member currently has essential dental, they need to stay in that essential dental plan for a minimum of 24 months before they can apply for the enhanced dental plan. And the forms can be found on the microsite. And if you have any trouble with that, you can always contact BC Pension Corporation for that form. Once the form's completed, it needs to be submitted to BC Pension Corporation. So that is registered through the enrollment process. And then the enhanced plan can be accessed.
Great. So next question is for Bonnie, and that is, can you tell us a little bit more about what the Municipal Retiree Benefit Trust is and why it was created?
So the Benefit Trust is an ELHT, an Employee Life and Health Trust, which is a creature of the Canadian Revenue Agency, if you want to call it that. And the plan partners made a decision a number of years ago, 3 or 4 years ago, to change the way in which benefits were funded. Previously, benefits were funded from employer contributions and premiums paid by retired members, but the employer contributions had to be used in the same year in which the contributions were made, and if they were not, then they went back into the general fund. So by creating the trust, we are now able to maintain any unused employer contributions, and they can be invested to earn investment income. So far, most of our claims can be paid for by member premiums and some of the employer contributions. So we are slowly building up a fund that can be used in the future for the provision of benefits. So it's really a way for members to have the benefit of the full 0.6% of the employer contributions and then investment income off of that.
Great, thank you for that, Bonnie. So question for Monique about pharmacare. A member would like to know why their prescriptions are mostly being paid by pharmacare.
Well, that's a great question. We are really lucky in BC to have such a great pharmacare program that pays for a portion of certain prescriptions and certain really high cost drugs. And this is great news that pharmacare is paying for a portion of your prescriptions, because it means that it's actually saving the plan some of these costs. The costs are being diverted to the pharmacare program, which is a public program. And that means that you can help save your $200,000 lifetime maximum. And you can keep that lifetime maximum much longer if alternative funding can be used before the extended healthcare plan. So that's a good news story.
Great. Another question for you, Monique, which is, how does living out of country affect eligibility? And if you're living out of country only part of the time, how is that affected?
So living out of the country is a little bit of a concern, because you need to be eligible for the MRBT benefit plan. You need to be a permanent resident of Canada, as well as have government coverage. And normally, if you're living out of the country, you don't have that access. And so, and as a result, you would not be eligible for the MRBT plan. So if you live overseas only part of the time, then the same would apply. So some individuals are like, snowbirds. They like to go travel for only maybe 6 months of the year. If you're traveling for around 6 months of the year, it's possible for you to keep your MSP coverage, as an example, and maintain your permanent residency status in Canada. And if that's the case, then you can maintain your coverage. It's just that no emergency out-of-country coverage will be paid, and only non-emergent claims can be submitted. So, for example, if you broke your glasses while you were traveling, you can submit for vision care services, that kind of thing, but no emergency services outside of Canada. I hope that answers your question.
Thank you. A question for Bonnie now, which is, can you tell us a little bit more about how the trust is funded and where we might be able to find information about the trust's current funding status?
So, as I said in my presentation, the trust is funded by 0.6% of employer contributions to MPP. It is funded by premiums paid by retired plan members, and then investment income earned from those two sources. In addition, we were provided seed money when the trust was created. It was $100 million, and then we were subsequently granted additional funds in the amount of $70 million. We will receive the last of that in this calendar year. So that money, along with investment income, is how the trust is funded. If you go online and you look at our annual report, which was posted about 5 or 6 weeks ago, there is additional information on the current status of the trust funds.
Great, thank you. And I will share the link to the annual report shortly. I just want to give some reminders because I know we have some people popping in and out of the session. So for those of you just joining now, you can enter your questions in the Q&A function at the bottom of the screen. We do anticipate having more questions than we're able to answer during our time together, but we will share some resources that you can use to help find the answers to your questions. And the session is being recorded, so you will be able to watch the full session in the coming weeks on the MPP website. So a question for Monique now, and that is, are dependents and spouses eligible for coverage?
Yes, dependents and spouses are eligible for coverage. You just need to apply for that coverage through BC Pension Corporation when you're making your application. Or, for example, if you were to have an extra dependent while you're retired, for example, you get married and you'd like to add your spouse to the plan, you can contact BC Pension Corporation for that information as well. Of course, all of the premiums are based on single, couple, family, and so you'll want to get that information from BC Pension Corporation as well as your dependent needs change.
Great. Another question for Monique, which is, are only psychologists covered for the mental health benefits, or is there coverage now for clinical counselors?
That's a great question. Yes, there is coverage for clinical counselors now, not just psychologists. And that information is available on our microsite or on member profile. If you log in, you can see which practitioners are eligible, and you can also take a look at reasonable and customary fees on our website to understand what those are.
Great, thank you. And I'm just going to pop into the chat here and share the link for the annual report, and then I will share the link for the microsite as well. There we go. And just bouncing back to the questions. Another question for Monique. Once you're on the enhanced dental plan, are you able to switch back to the essential?
Right. Yeah, unfortunately, no. So once you're on the enhanced benefit plan for dental, you can stay on that plan for as long as you'd like. If you're no longer interested in having dental coverage, you would need to cancel that through BC Pension Corporation. You can't shift down to the essential plan. There's only shifting upwards and not downwards.
Great, thank you. Another question for Monique. We've just had a question come in about the lifetime maximum that we've talked about. Does that include just the amount of coverage you've used during retirement, or does it include what you may have been paid out in your pre-retirement years if you were with Pacific Blue Cross?
That's a great question. So the MRBT plan is entirely separate from whatever plan that you were registered for previously. This particular group plan has a $200,000 lifetime maximum. And so that starts from when you enroll in the MRBT plan. So any claims that you may have incurred previously are not included in that amount. It's just the amount that you're using during your retirement years when you've enrolled in the MRBT benefit plan.
Great. Now, a question for Bonnie. When you retire, is that automatic that you get coverage through MRBT, or is that something you need to opt into?
No, when you retire, you will be provided with the option to enroll in the extended health and dental that's offered through MRBT. That information is included with the package of material that you're provided by Pension Corporation as you're completing your enrollment or pension. You have, if you don't join the extended health and dental at that point in time, you have 60 days from the date of your retirement to enroll. And if you don't, or if your partner is still working and that person has extended health coverage, then you can enroll 60 days after that plan ends. But it's not an automatic transfer over to any of the benefits that are provided by MRBT. You have to make a conscious decision to enroll.
Okay, great. Now, a question for Monique. Do you need to start on the essential dental plan, or can you jump right into the enhanced when you're retiring?
It's a good question. Yes, you can choose. You have a choice at retirement, and you'll notice that on the forms as well, that you can choose the essential plan or the enhanced right at time of enrollment. And based on that, then decisions come thereafter. So if you've chosen the enhanced plan right at the onset, that's not a problem. You'd have access to 70% coverage up to the $2,000 calendar year limit per person.
Okay, thank you. I'm just going to pop the microsite link into the chat again. We had a question of what the microsite is, and it's just a website where you can find some resources. Maybe Monique, can you talk a little bit more about what's available on the microsite?
Sure. I'm always excited to talk about the microsite because we put a lot of thought and effort into trying to make this as accessible as possible for the retirees of the MRBT. It has so much information. At the top, there's always some announcements, links that lead to updates on the MRBT plan, if there's any board communications. Then further into the site, there is information about your plan. So booklet information, brochure is available. And up and coming now, soon to be posted, is Benefits at a Glance one-page document that gives you a quick overview of the coverage that's available on the plan. And in addition, there's forms. So if you wanted to move from the dental essential to enhanced plan, the forms are available there. There's so many other resources available to the retiree membership. And that also includes articles. We post twice per year articles that are relevant to the retiree community. So whether it's with regard to prescription drugs or travel suggestions, we would encourage you to visit the microsite on a frequent basis because it is updated continuously, and essentially all the answers to your questions are located there.
Thank you. Sounds like a great website for everyone to check out. I'm just going to pop another link in the chat, and that is a link to the About the Municipal Retiree Benefit Trust page. And there are a couple of new documents that have just been posted there. There is a Benefits at a Glance document where you can take a look at what's covered just in a one-page overview. And then there's also a retiree guide that's going to have a lot of information about some possible frequently asked questions, as well as basically anything you need to know as a retired person enrolling in MRBT. So Monique, another question for you now, which is, are there different levels of coverage available?
So we've talked a bit about dental today. There are two different levels of coverage for dental, but for the extended healthcare, there is only one plan for the MRBT. So there isn't another selection to make and such. It is just the one plan.
Okay, great. Apologies, I'm just having some technical difficulties here. Let me see if I can find a question. Monique, is Pacific Blue Cross considering implementing multi-factor authentication to increase the cybersecurity?
That's a good question. PBC is consistently exploring technology process enhancements, and multi-factor authentication is actually being considered and is on our future roadmap. But we do need to consider the fact that some users aren't able to support multi-factor authentication. And so we're looking into ways of making it an option for the membership. For the mobile app, we do actually have enabled enhanced authentication and security to make that more secure. PBC is always looking for ways to improve that space and improve cybersecurity. So yes, to answer the question, yes, it is on our roadmap.
Great. So we have about 10 minutes left for your questions. Again, if you have a question, you can post them using the Q&A function at the bottom of your screen. And I apologize, I'm continuing to have some technical difficulties accessing these questions. So I'm going to look at some of our pre-prepared questions. So let's see, Bonnie, can you talk a little bit about the actions that the MRBT is taking to strengthen the group benefits?
Well, we work regularly with Pacific Blue Cross to find the most efficient way of providing maximum coverage for members. As I said, we're also looking at a plan review, and we will consider all of that. But I think the main issue I would say about improving is just our new funding model and being able to earn investment income. I know it may not feel like that to people that have been retired for a number of years and have not seen major improvements, but in the future, with investment income, I think that there will be the ability to look at various options of the plan and make sure that it meets the current retiree membership, but it also needs to be available for members who are contributing now through their employer contributions, so that when they retire, they also have access to extended health and dental benefits. So I think that's the main way, is really just being, I will tell you that as a board, I think we're really, really frugal in terms of our keeping administrative costs as low as we possibly can to ensure that the maximum amount of money is available for plan members.
Apologies, I was muted there for a second. Thank you, Bonnie. Question for Monique about the lifetime maximum. That's something that's coming up a lot in our Q&A. And is that maximum per person?
Yes, it is. Yes, it's per person. Yeah, that's correct.
Great, thank you. And question for Monique. If you retire and then you get another job that has benefits, can you opt back into the MRBT in the future?
So as long as you have continuous coverage, you are able to join up the MRBT plan. I think you're mentioning this because a person may have chosen to retire, but then seamlessly got another position. That's what it sounds like, and had coverage through that organization. So technically, they didn't retire, but they can get coverage again. Once their continuous coverage has ended, they need to apply within 60 days, like Bonnie clearly mentioned before, to ensure that the coverage will be accessible and seamless.
Thank you. All right. Monique, can you tell us a little bit about the mobile app? What do you need? What's the easiest way to get it? What should the member be looking for?
Oh, well, technically, you just go to your app store and download the Pacific Blue Cross app, and you can start using it. You enter your information from your ID card, and you can access the mobile app just like in the same way as you would access the member profile on our website, except it's on your phone and super convenient to use. Once it's actually on your phone, I find it super convenient because you can just look into it. You don't need an ID card anymore. You can simply just have that on your phone, and that information is populated when you click on the app. So you can show that to your pharmacist or your paramedical practitioner. What else do I do with it? I think you can view claims activity as well. So you can see how much do you have left. Let's say you went to see your chiropractor and used $250 worth of the coverage this year, and you have another $250 remaining. You can see that information directly on the app. And in the same way, if you prefer a laptop or a computer, you can access that information from the member profile. They do work hand in hand, both devices, and I'll just continue to chat about them because it's, I think, of interest to the membership. Through both different ways, you can access the claims and submit claims electronically, whether it's from your computer or if it's directly from the app.
Great, thank you. Another question then for Monique. Is there, sorry, where did the question go? Is there a place on the site, the Pacific Blue Cross site, where you can check where pharmacies sell your prescription drugs and the cost per pill so you can find the lowest cost?
Yes, so we do have that tool available on our website. If you can also take a look through member profile, you can access information about the drugs that you're claiming, and you can actually test to see if which drugs are available or not on the plan by entering it in on the member profile. You can also take a look at where costs are cheaper. So for example, if you wanted to go shop at Costco, their dispensing fee is normally much lower than, for example, a pharmacy like Shoppers Drug Mart or Rexall, those kinds of pharmacies. And so you can get that information through our website as well.
Thank you. So we have about 5 minutes left for questions. Just a reminder, this is the dental and health session. There is another session happening right now if you have questions about your pension in general. Bonnie, I know we talked a little bit earlier. We answered this question already, but we've had lots more questions. basically, how does MRBT make decisions about what to include in coverage, and are they going to be doing a review of coverage coming up?
So we contract a plan with Pacific Blue Cross. We look at that plan regularly. We get member requests that are reviewed once a year as a board. And as I said previously, the board is beginning to evaluate the process of a full plan review. What is the scope of that review? What is the timing of that review? And that information should be available to plan members in 2025 once those decisions are made. So at that time, we will go through along with our benefits advisor and look at what's currently covered. Your prescription drugs are covered by, with your plan, and that's the Blue RX formulary that you're familiar with. But the other services, we'll review those as well and determine based on cost and projections what's possible within the plan. So there will be a plan review coming up. I can't give you the details of it today because of our planning calendar has us making those decisions later in the year. But once they're made, that information will be shared likely mostly on the new MRBT website with access, so it's easier for you to find us, and that information will be there. We will also work with MPP to get that information out, and with Pension Corp, we do not have access to individual member emails, so we don't communicate with you directly. I mean, that's something that I think for better communications, we're going to have to look at our options about how we begin to assemble a list of plan members so that communication can be from the board to plan members. But right now, we use our website, we use our annual report, we do our year in review. We have a couple of new documents up, and once decisions are made, they'll be posted as well.
You.
Heather, can I just interject?
Absolutely, go for it.
Okay. So I just wanted to clarify. I see there's a few questions about drugs and costs, and I just wanted to clarify that our website has a tool called Pharmacy Compass. You can look that up online, and through that Pharmacy Compass tool, you can take a look and compare between pharmacies how much, for example, your Lipitor at a certain milligram costs between various different pharmacies in your neighborhood. And you're able to see which one offers it at the best price. And so those are small ways that you can make sure that you're taking care of your $200,000 lifetime maximum and reducing spend where possible, but yet still getting the excellent benefits and services that you need.
Thank you. That's a great tool. I'm just going to remind everyone that this session is being recorded, as well as the other session will be recorded as well. So those will both be available on the plan website in the coming weeks. And we are just about at time now, so I'm going to wrap us up with that. So thank you everyone for joining us. If you have more questions about eligibility, enrollment, or premiums, go to myaccount.pensionsbc.ca and submit them via Message Center to the Pension Corporation. If you have questions about coverage or claims, you can contact Pacific Blue Cross. And you can now join the main annual general meeting session where informational slides will play from 11:45 to noon, and the meeting will start promptly at noon. So to get back there, you'll just want to click leave to exit the breakout session and return to the main meeting platform. Thank you again, everyone, for joining us.
Thanks, everybody.
Thank you.
Thank you.